Hi, everyone. Good afternoon. Today, we are joined by Aundrea DeMille, who has been appointed by the Lieutenant Governor and the Governor of Utah to help write equity, diversity, and inclusion policies for the state of Utah. Aundrea is an international keynote speaker and the podcast host of the Wake Up series. She attended Georgia College and State University, where she graduated with honors, earning a BS in Community Health and Human Services. Aundrea, thank you so much for joining us. It's nice to see you.
Hi, yes, thanks for having me. It's my pleasure.
Of course. So I'd love for you to start out with just giving us a quick introduction to who you are and what you do.
Yeah, so I am the maker of men. I have 5 boys from 18 down to the age of 3. I've been a Utah native for about 3 years now, and I own a real estate marketing company, but what I was called to do is to share stories to help people wake up to unconscious bias. I help organizations bridge the gap between policy and people, and so that we can all just create a better world.
I love that. And I love that you said that you were a maker of men. That's very cute. I like that. That's a good tagline or saying. So you mentioned that you are involved with these policies. Can you talk about your recent experience with Project Gateway, Equity and Opportunity Commission for Utah, and how you're involved with writing these specific policies for our state?
Yeah, so I was commissioned to be on Project Gateway, as you mentioned, and that was a commission for the transition team for the Cox-Henderson transition. And so we came in, myself, we were, and about six to eight other people to really help come up with ideas for equity and opportunity for minorities, people of color, women, the LGBTQ plus community, to really give suggestions on what our government can do to help some of our underserved communities. So yeah, we were conditioned to help give them suggestions. We did some research. We talked to very influential people in our state and at a local level, and community leaders to get feedback. We did some research to kind of, uncover some of the needs in Utah when it comes to people of color and minorities in the LGBTQ community, to help guide our administration so that they can, write policies that are more equitable.
Along those same lines too, how long have you been involved with policies or political projects before? Is this a passion of yours that you wanted to be involved with? How did you kind of bridge that gap between kind of your everyday life and then jumping into this role?
Right. So really it started unofficially, non-publicly years ago when Trayvon Martin was murdered. When he was killed in Florida, and George Zimmerman, the whole case went down with the stand your ground case. That's really when I started speaking about it amongst like book clubs and groups. And I kind of became that friend, that the Black friend that you could, ask those uncomfortable conversations with when it comes to race and things like that. And then I became public about it last summer when George Floyd was murdered, because my kids were then at the age where they can drive. At the time, our 17-year-old had just gotten his license, and our 12-year-old would go ride with him in the car. And we live in an affluent area where there's not a lot of Black and brown people, and it's very easy to suspect that my kids don't live there or don't belong. And so I became more vocal about it publicly last summer. And so when I became public about it, I put a video on really what it's like raising Black boys in America. And these are some of the things that we have to deal with and the conversation we have to have. At the time, Lieutenant Governor Cox, our new Lieutenant Governor is Henderson. But at the time, Lieutenant Governor Cox and his campaign caught wind of the video that I put out. And so they actually came to my home, he and now Lieutenant Governor Henderson and Governor Cox's wife, Abby, and a couple of their campaign staff came to my home, and we talked about some of the things that happened to Black and brown people in Utah. And I gave them very personal stories that I have experienced since living here and that we've gone through and that our family has gone through. And so once they came and shared some of those stories, I was very frank. I said, this is something that's not talked about very often in Utah, where the predominant race is white. And people think that discrimination and bias and sometimes even racism doesn't happen anymore. But we need to talk about it more so we can understand where people come from and bridge that gap and create more unity. So if I can help in any way, please put me to work. Well, as we all know, Lieutenant Governor Cox at the time became elected. He won the primary, and then he went on to win the election. And so they gave me a call once they got in office, and they put me to use. And so that's really how I got involved. It was just through some personal storytelling. This is what I've done. These are things we've experienced. This is what I would like to see change in the state of Utah. And I do have a background in community health and human services, so I understand that piece of bridging gaps and working with people in different communities so that everybody has equal opportunity and access. So that's kind of how it came about.
I really appreciate you talking about that. I think it's important for people to understand people's perspective and mindset in the work that they do, which brings me to something that you're currently working on, which is One Utah Roadmap. I was kind of reading about this before, but I'd love for you to tell us what this project is and what this project actually can mean for our community.
Yeah, so with the One Utah Roadmap, that after we were able to present some of our suggestions for the policymaking, Governor Cox and Lieutenant Governor Henderson went back and with their administration created the One Utah Roadmap. And so with this project, they go over 6 strategic priorities that we are going to work on in Utah in the first 100 days, 500 days, and so on during their administration. And those things include economic advancement, education and innovation investment, that the role matters, working with the healthcare industry, equality and opportunity, and also streamlining and modernizing the state government. And so that's what the roadmap is. And really what that means for the community is that the Cox-Henderson administration is passionate and dedicated to making change under those 6 topics while they are in office. And so what that means for the community is, for sure, they're going to conduct a full review of the COVID-19 pandemic to see where any gaps lie, and so that we can be better prepared if anything like this ever happens again. But also, it's probably going to open up where we have some gaps between underserved communities and in terms of access and education. And some of those also include conducting research, like gathering research and data, because really you have to have that in order to really impact change, right? So doing research and data to help close that gap for women, the pay gap for women in the state of Utah and the private sector, and just helping with improving the culture and opportunity and access for women in the state of Utah and in the LGBTQ community as well. And so under that roadmap, I helped with the equity and opportunity section.
I think that's really important. You brought up community health, and your background is in that. And from a healthcare system perspective, a lot of what Intermountain focuses on is the social determinants of health, the access to health. How can we help get those services out to different people, the underserved community, like you mentioned, and how can we really kind of bridge those gaps as a company ourselves? So I think it's great that you're heavily involved with this, and it definitely gives people the opportunity to kind of learn more, because like you mentioned, I think we all sort of have this facade that it doesn't happen, even though it definitely does. And I think it's something very important that we need to talk about. You mentioned too the pandemic, and we talked about this in some blogs that we've written, that there's been this definite disproportionate effect on the pandemic on women of color, especially those who have families. Can you talk a little bit about what some of those are, and maybe how we could in the future change that and make that a little bit more equal across the board?
Yeah, so right now, what we've noticed is that, while minorities in the state of Utah make up 20% of the population, by 2050, they will make up 30% of the population. So that's a 10% increase in the next, 30 years. And what that means is the babies that are being raised now, the children that are being now, are going to create to a greater population of the minority population in Utah down the road. And so because of that, we want to help, like you said, bridge the gap, because one of the things that we noticed during the pandemic and some of the studies that we've looked into to give suggestions is that when the schools and businesses closed down, during the shutdown last year, 60% of the jobs that were eliminated were held by women. And so that was a big, kind of epiphany of, oh, that there's a big gap, right? And then we also noticed that within Utah, we have a heavier Latino population in terms of people of color in the state of Utah than we do that are Black or Indigenous, Asian, Pacific Islanders. And so when you're looking at the biggest minority group in Utah, which is our Latinx population, 17% of the children populated in Utah represent 44% of those who are uninsured. So that's a huge number. That's 71,000 kids of Latina and Hispanic descent in the state of Utah that don't have insurance. And so here in Utah, that Latinx population has been hit by COVID the hardest. And like you said, COVID has definitely helped to show that disproportionate access to healthcare. And really, I think it's, I'm not speaking on behalf of the Cox administration. Let's get that really clear. But personally, I think it's hard to ignore the fact that there are gaps, because COVID can't see color, right? And so when you look at the minority populations in our state, why is it that the Latino population was hit heavier than some of the other, races and demographics in the state? That's what we have noticed. Now, I do know that we suggested to conduct more research to understand why there's the gap, why there's the lack of access, and what some of those underserved populations need in order to bridge the gap. So I do know that there are discussions that are happening to kind of turn that around and make things close. And if we go back to, like you mentioned, my community health background, you're gonna want to look at getting the stories from those who underserved populations, right? You want to understand, hey, where are you shopping? Where do you go to school? Who is your doctor? Do you know who your doctor is? Do you know how to find your doctor? Do you know how to find information on the pandemic? Do you know how to find information on vaccines? Do you know how to find information on immunization? How much do you know about breast cancer, or, the heart disease? And, when we do that, I can't even remember what month that we focus on heart disease, the red month. Is it this month?
Yes. It's very timely.
Right. And so you can tell I'm not a nurse or a doctor. Right. But it's having those conversations of, are you aware of these things that are happening, and that these resources? And in my opinion, it's going to go back to storytelling, and really sitting down with these people to understand what they know. So then we can understand how to put measures in place to give them more opportunity. Because one of the things that we did focus on is not just opportunity for our underserved communities, but access. They need access to it. And I think that's what's really going to help bridge the gap between the two.
I want to bring up a couple points you mentioned. One, sure. This pandemic does not know who you are, what you look like. And I think that's really important, because as someone who works in healthcare, I think we really need to understand that the virus does not care what you look like, and anyone can get it. But why is it that these communities are experiencing a bigger effect on that? And learning about that is really important. And but from an Intermountain perspective too, I know that we've really tried to create more access points. To your point about access, we've had some mobile testing units that have gone out to certain communities and areas, and we're trying to translate a lot of our information into Spanish. So that way the Latinx community has access to that, because like you said, it's not only how they can find it, but also what the healthcare systems and other companies are doing to provide it back to them.
Absolutely.
So it's definitely a two-way street. We can't have one without the other. And I think that's really important for people to understand.
Right.
So I appreciate you bringing up those points. You mentioned this word, bridge the gap. We talk about that a lot in public policy. What are you specifically doing to kind of help bridge this gap between the policy side and the access opportunity side to these underserved communities?
Yeah, so what I specifically do is I go into organizations, schools, businesses, and I help them, one, understand, and help tweak their policy if that needs to happen. But then what we do to work on bridging the gap is getting to the why. We have to be able to change our feelings if we're going to be able to make an impact and difference in this world. And so what we do is focus on unconscious bias through the power of storytelling. So everybody has unconscious bias, myself included. The first two things that we realize when we meet somebody is one, their gender, and two, their race. And that's without even thinking about it. That is what the brain computes. You notice their sex and their race. And so that's your unconscious mind driving your decisions. And what we don't realize is if you've been seated with thoughts of, most, people of color are on welfare, or, they're the gangs, the thugs, they're more likely to steal. They're more likely, when you watch movies that show Black and brown people as the villain, or as the maid, they're the help, they're the ones cleaning the toilets or cleaning the hotels, or they're the ones cutting the grass, and you see these images, you hear about it on the news, you read about it in school. Those feelings get planted into our subconscious mind and start to drive the way that we feel about people without even realizing it. And so we may unintentionally treat people differently just on the way that they look because of the unconscious bias that's been planted into our subconscious mind. And so I help people and businesses, communities, and industries wake up to, one, our unconscious bias that everybody has, because if you don't recognize it, we can't change it. And two, after we wake up to it, we work on planting new, really good, inclusive seeds. And so we work on what to do when you feel afraid if someone walks into a store in a hoodie and you clench your purse a little tighter. We work on, why did you feel uncomfortable when you walked into a room where the predominant race was a different color than your own, right? Once you can recognize it and then start to talk yourself through the process of changing. And I'll give you this example. I am completely guilty of it. We stood on the steps of our our state capitol, and we, Governor Herbert and everybody's signing the inclusion compact. And so everybody's in suits and coats and ties and jackets and, dressed very appropriately. And it was snowing. And up walks a Latino guy in no shirt and baggy jeans, and he had tattoos everywhere. And when I looked at him, my first thought was, what's he doing here? And does he belong? And, is he going to start trouble? And then I caught myself and I was like, Aundrea, stop it. You assume that because of your programming. The reality is he is here to witness this historic day, and he had the biggest smile on his face. And he was so excited about what was happening. And I was so glad to see him. And so within 30 seconds, my feelings drove me to have a thought, but I was able to catch my thought and change the way that I felt about this individual. And that's what I do. I go and I teach people how to change those feelings and change those thoughts, because once we change our feeling, then we can bridge the gap between policy and people. We can have all the policies in the world, but if our people and the workplace, our healthcare workers, construction, real estate, brokerage, like whatever business you're in, the dentist, the doctors, whatever business you're in, you can have policies in place, but if those in the business aren't changing the way that they feel about their bias, you won't see a difference in the culture, and the work culture or the community. And so that's really what I go in and help people do.
I think that's really important from a healthcare perspective too, to have that, to be able to connect when you're making that unconscious bias decision or thinking about that, because we've kind of talked about this theme throughout the whole thing. Everyone does deserve equal access and opportunity to healthcare and other community needs. So Intermountain actually does a lot of this too. We have unconscious bias training to figure out how we can kind of remove those filters from ourselves and figure out the best way to actually treat our patients. So I love that example that you gave too, because anyone can do it. It's not something that you can kind of turn off. It's something that's just inherently human. So once you learn about that and can kind of see and understand what you're doing, I think that's like what you said, you can make an actual difference in your everyday life.
Yeah, you can't turn it off, but you can get better about planting more inclusive seeds so that you are starting to have better feelings and taking control of your subconscious mind.
On that note too, so say I'd like to get involved with this, I'd like to be able to do something that makes an impact outside of myself. How can individuals get involved in this community effort?
Yeah, so I'm really glad that you asked that question. A lot of people say, I don't know what to say. I don't know what to do. I love everybody. I would say step one is that you've recognized that maybe you have some bias or that you want to make a difference. Great. That's step one. Step two is to start to talk about it. We have to normalize having uncomfortable conversations about our biases. And whether that's any bias, whether it's bias about women, men, because of the color of your skin, because of your sexual orientation or preference, we have to be able to normalize these conversations. And I feel like right now in America, the word race or racism has become so taboo. It's like sex. Nobody wants to talk about it. I just love everybody and we don't need to talk about it. And I was like, no, we still need to talk about it. Start talking about what it is and your home. Teach your kids what racism is and that it's real, and give examples and use stories. And if you don't have any stories of your own, you can do things like listen to a podcast. My podcast, The Wake Up Stories, is just that. We bring a guest on every week to share how they have experienced bias, and we teach people how to change it. Or they come on and say, I used to be very closed-minded and biased about a certain demographic, and now I have woken up to it and I've become an advocate. So you can listen to podcasts, read books. Don't be afraid to talk about it is really what you can do. And then in terms of the community, get involved. Go volunteer in a community that looks different from your own. And I guarantee no matter what that is, right? Start with something if you like to cook, go to cooking classes or go teach people how to cook in an underserved community. If you like to cut grass, get a group of young boys in another community and teach them how to do lawn maintenance, gardening, baking. You can volunteer. There's unlimited resources of where you can volunteer outside of your own community. And once you do that, I guarantee you're going to start to learn to love these people for who they are. You're going to hear their personal stories. You're going to understand who they are and where they come from. And then that's going to help you be able to bridge the gap from some of the stereotypes that we all have been programmed with. And when you really get out, and so just start in your own sphere. And then in terms of an organization, look at your own policies and say, what do we have in place for inclusive policies? Do we have opportunity and access for all demographics in our workplace? And if not, let's get some written. I can help with that, bringing me on. And then if you have policies, like you mentioned, you guys you do ongoing unconscious bias trainings at Intermountain. Ask yourself, are we doing ongoing unconscious bias trainings in our organization? And if not, give me a call. I can help you with that. There are many consultants that you can bring in to help. So those are some of the things, but really it starts with the conversation, the willingness to learn and serve those who look, think, and feel differently from you.
I love that. And I love the idea of just finding something you're personally passionate about and teaching and helping other people. And I love the term to listen and learn, of kind of figure out what you like to do and then go listen to how you can better help people. I think that'll make you more involved and want to just kind of see the change that can happen. So I really appreciate that. Aundrea, thank you so much for joining us. I really enjoyed this conversation. It's been really insightful and it's definitely taught me things as well. Again, thank you so much for joining us, and we will talk to you next time. Thank you.
Thank you. It's my pleasure.
Bye-bye.
Bye.